Welcome to Leadership Academy for the Public's Health Masterclass Series, Partnership Development and Community Engagement. My name is Merlene Tucker, and I'll be running today's web forum along with my colleague, Jeff Bornstein. Today's web forum is sponsored by the Leadership Academy for the Public's Health, a program of the PHI Center for Health, Leadership, and Impact, and produced by Dialogue for Health. Let's meet the moderator of today's event, Dr. Edward Ellinger. Dr. Ellinger is a coach and advisor for the Leadership Academy for the Public's Health, a program of PHI Center for Health, Leadership, and Impact. He's a public health metaphysician who has spent his professional career working in various settings to advance health equity and optimal health. Welcome, Dr. Ellinger.
Thank you, Marlene. It's really a pleasure to be here with the panel members that we've got, but also with all of the folks from various places around the country. I understand we have close to 500 people signed up from all over the United States, and who knows, maybe even beyond. So I'm really looking forward to our discussion today. And this session, this is the first of a series that the National Leadership Academy for the Public's Health is putting on to focus on a variety of public health issues and let people know some of the things that are going on with the teams that are sponsored by NLAPH. And so like I said, we'll be focusing on a variety of issues over the next several months. But today we're going to be focusing on partnership development and community engagement. As Merlene said, this program that we're doing today is a masterclass on what some of the things that NLAPH programs have done on community leadership and impact, and it's sponsored by the Public Health Institute Health Leadership and Impact Center. And that center in 2011 started the National Leadership Academy for the Public's Health, or NLAPH, and you'll hear NLAPH stated frequently. And since that time, that NLAPH has been bringing emerging leaders together from multiple sectors, from health, housing, education, transportation, law enforcement, and many others, to build, for the purpose of building local capacity to really impact health and equity in their communities. And NLAPH does this by having people form 4-person teams, usually 4 people, but often 1 or 2 more, depending on the situation. But they have to be multi-sector teams that come together to learn about advancing their leadership skills to achieve health equity and optimal health for all in their community. And NLAPH uses evidence-based approaches to help people kind of learn a whole lot about their public health challenges in their community and how to lead forward with those things. They focus around some kind of project, and these projects that these teams pick range from chronic disease prevention and disaster preparedness to safe streets and food insecurity, from adverse childhood experiences and lead poisoning to workforce development and maternal and child health issues. They come together for those things, and they learn about their individual and team leadership skills. They really learn how to work across sectors and multi-sector approaches. They learn about continuous quality improvement, and they learn how to use data and managing messages, how to deal with conflict, and they learn about systems change. Excuse me. And over the last 13 years or so since NLAPH got started, over 200 teams have really been put together, and they've participated in this program, and the impact has been dramatic. Certainly the impact on the projects themselves, which are a year-long focus or are important, but the real impact is the change that these leaders experience in developing leadership skills, in developing partnerships, engaged in community, that has an impact longer term for public health in their communities. And not just in these communities, but what you'll see, I think, actually some national impact from the work that you did locally. So this masterclass series has been put together to highlight some of those factors, some of those teams that have been working on this and what they've learned in the process. And we hope that today and in the next one on July 16th, which in the masterclass series, will provide all of you listening some opportunities to hear what's going on across the country, to learn from what's being done on these teams, with the goal to have you learn how to collectively impact factors in your community, how to develop partnerships, the importance of developing partnerships, why individual and team leadership skills are so important, and then give you some practical examples, which you'll hear 3 of today, about how that actually can play out in communities. And just to give you a little highlight about what's coming up, the July 16th Masterclass Series, which my colleague Kathy Slemp is going to be moderating, is going to be talking about the power of arts and culture in improving health, which I think is really going to be interesting because they're going to be focusing on how arts and community health are really synergistically work together to improve health, how arts and culture can influence society's understanding of what the issues are in their community, and how sharing cultural backgrounds and cross-cultural exploration is really an important part of public health. So you have something to look forward to with that July 16th session. But today's section is going to focus on community engagement and partnership development. These are essential tools for advancing health equity and optimal health for all in your communities. Now, I think this is an appropriate focus for the start of this masterclass series because it gets at the core of what public health is all about. As those of you who worked in public health, you know that the Institute of Medicine in 1988 and then reaffirmed in the early 2000s that public health is what we do collectively as a society to assure the conditions in which people can be healthy. What we as a society do collectively. That speaks to the whole idea of everybody's engaged, everybody needs to be there. We need partnerships, we need to work multi-sector, we need to be collectively working. That means engaging with communities, partnering with different groups and sectors, and moving forward on that. And we're going to be highlighting that in this first masterclass session. And I can't think of a better day to do this than today, which is the 105th anniversary of Congress passing the Women's Suffrage Act. On June 4th, 1919, they passed the Women's Suffrage Act and then sent it on to the states for ratification as the 19th Amendment, giving women the right to vote. I don't think, in my personal opinion, that the ratification of the 19th Amendment, giving women the right to vote, was the biggest public health achievement of the 20th century. Now, I know some people will argue that, but I believe because it had a huge impact almost immediately on maternal mortality, on infant mortality, on the development of public health, on the development of data collection and vital records, that women's right, giving women the right to vote, engaging half of the population in decisions about how our country will function, our health system will function, was really important. So that's forming the basis of why I think, this class is so important today. So with that background about community engagement and partnerships, we have representatives from 3 of the teams that have engaged with different communities in different places around different issues, around workforce development, around nutrition policy, and statewide equity. I'll introduce each of these participants, presenters, in a little bit more detail when it comes to their part of the program, but I want you to know that we're going to be talking about the Kansas team, which was the Kansas Community Health Worker Partnership, which Elaine Johannes was the lead. And they really worked on workforce development issues around a population of folks who really can have an impact in their state at the community level. So you'll hear about some of the efforts with that. Then we have the Iowa team, Going Bold, Iowa. With Angie Tagtow was the team lead with that, really looked at nutrition policy and again, developed a whole system of different partnerships and relationships among academics and public health and agricultural policy that really, again, has an impact both locally and nationally. And then the third presenter is with the Wisconsin team, which is called Thrive Wisconsin, the Wisconsin Alliance for Health Equity, which actually was one of the first teams that got started in 2013. The Kansas team met in 2021 and the Iowa team in 2020. But Margarita Northrup, who was not a member of that team, but is actually carrying on some of the work that the team started, because the lead of that team actually now is the state health commissioner in Wisconsin. And so, I mean, it highlights the fact that these programs give you some individual and team leadership skills that really, I hope, advance your work as you move forward. So let's get started. And we're going to be working as we have, from south to north and here in the Midwest. And I told people that these programs will show you that in the heartland of the country, we have some things that are really good besides wheat and corn and pigs and chickens and turkeys and cheese and beer. So you'll hear some of these things that are really, really good going on in the center pace of our country. So we'll start with Dr. Elaine Johannes. She is the Kansas Health Foundation Distinguished Professor in Community Health for K-State Research and Extension, and is a state extension specialist in the Department of Applied Human Sciences in the College of Health and Human Services at Kansas State University. And by the way, she invited me down to talk to the extension folks, which was really a highlight of the last several years, meeting with those folks. Elaine has extensive experience in working in communities to address health disparities, unequal access to healthcare, and the social drivers and conditions that impact people's health. She's a member of the Kansas Maternal and Child Health Council for the Kansas Department of Health and Environment, a member of the Kansas Suicide Prevention Coalition, and is the governor's appointee to the Kansas Department of Corrections Kansas Advisory Group for Juvenile Justice and Delinquency Prevention. And particularly fitting for today, she is president of the Kansas Community Health Worker Coalition, and she teaches in the Kansas Community Health Worker certification courses. So, Dr. Johannes, it's yours to wow us with what's going on in Kansas.
Thank you, Ed. Thank you so much. And I'll ask Jeff to bring my slides up. First off, I want to thank the National Academy for the Public's Health for this opportunity to be part of the first inaugural Masterclass. It's an honor, a privilege, and I hope I do the justice of the goals of the Academy, which are to inspire, share ideas, give us a chance to implement, and hopefully my story will show we were able to implement something that is sustainable and also sustain what we're doing. So it's an honor and a privilege. So we were part of cohort 10, and you will see that was in 2021. I did have the privilege to lead, but today I am the person to narrate our story. NLAPH had taught us as a team the importance of framing our story, especially in times of challenge. And so I hope to unpack our story with you in the time I have, and then to inspire. The motto of Kansas, some of you may know, is ad astra per aspera, to the stars through difficulties. And you will see in our story that we had difficulty, mostly because of the context. Think back of what was going on in 2021 for you, but then also I think we reached the stars. So we did that through some tears, some tough times, but also by really enjoying working as a team and laughing. So hopefully you like the photo that we have on the slide of the Kansas frosted mini wheats. These are bales of hay. Some of you may remember what those look like from the Midwest, but this is a photo that actually was taken in 2021, and we did laugh about it. And we also had some reflections about why the Midwest work in our state counts. Next slide. So we were friends before we were a team. The six of us, and Ed, yes, we were one of those strange teams that had more than four. We petitioned to have six, but we were friends. And much like the movie Stand By Me, some of you may remember, a hodgepodge of friends. Some of us had more skills than others. Some of us had better access to a resource. We were friends, and our story then convened and wove together around the academy. I was fortunate to be the lead. I did write the application, but along with myself, Diana Lady, who at the time was a lead with the Kansas Farm Worker Program at the Department of Health and Environment. She has since that time still been part of our team. She's completed her MSW. Along with that person is also Sandy Proctor. Dr. Proctor has been a friend of mine for many years. She's an extension specialist, but she had done work in Kenya with community health workers for many years. she actually understood what community health workers could do in this state, the nation, and across the globe. She saw it in action. Alyssa Rankin, Wichita State University, is still with the Center for Engagement at Wichita State, and she was a backbone. She continues to be one of the leaders nationally in community health work. Then Matt T-Ball is with the Kansas Business Group on Health, which is part of the Medical Society in Wichita. He represented some of the provider interests in our team and across the state. And then finally, Barb Wyman is a nurse. She is the owner of BE Education Group, and she actually was the first person in the state that was able to get a federal HRSA grant to start training community health workers. So we had a team of friends. We had a team of different universities, different perspectives. We had business, we had industry, we had education, and we had the state Department of Health. Our friendship started clear back in 2017 when some of us in the education side started thinking about, well, this community health work course that we had heard about that Barb taught, is that an academic course? And so clear back in 2017, we started to find out it was much more powerful than an academic course. It was a workforce preparation and a workforce ladder. So from 2017, we started to meet together informally as friends. In 2018, the universities actually started to meet. In 2019, this group of friends decided, you know what, we need to take this a step ahead and involve employers. We did not have a certification in our state. We did not have a registry. We had some really exceptional people who knew what community health workers did, and we were starting to think about a course to improve the quality of the delivery and to align our state with the APHA definition of community health workers. So it was March 13th of 2020. We drove all the way to Salina, a little town west of me. We met for a full day, and during that day, we were hearing our telephones go off with notices that the pandemic was in Kansas City. COVID-19 had been diagnosed at my university. And when we got back to Kansas State University, we could not go into our offices. So here we were, a group of friends, dynamic. We were planning ahead, and enter the enemy, the foe of the pandemic. Next slide. Well, we already knew our data. So Kansas, as a healthy state, had been in the top 10 for several years. You'll see there in 1991. In some metrics, we were really number 6 in health across several indicators, but we went downhill across many years. So by the time 2019 happened, we knew what our data, we had gotten data, of which LAPH encourages us to do, and we wanted to go ahead and make change. That's the reason why we were meeting. That's the reason why we, as a group of friends, thought we could influence that. Well, enter 2021, the pandemic, masks, the pushback against that, also some of the race concerns. Yes, we were one of the states who had issues that people were concerned about that did march. We also had some people unconvinced that critical race theory needed to be taught. Then we also had wildfires. We were having drought, which we currently do. And in 2021, in the middle of December, we had a wildfire that resulted in death. Our challenges were great. Our concerns were many. And we also knew that we needed to stay the course. We needed momentum because is that we had a goal to improve the health of Kansans. We wanted to provide equitable access across populations and then change the direction of these rankings for our state. Next slide. We also had a theory that if we would work together, continue the course, don't let the pandemic influence it too much, but work on really professionalizing the career path for community health workers, we could make a difference. And we weren't going to be undaunted. We were going to aspire to the stars. And so, community health workers, for those that may not understand who those people are, they are the frontline public health workers who are trusted in the community. They represent either the vulnerable population, the geographically isolated community. They represent the liaison between healthcare practice and providers and the individual. And we, as a group, were convinced we were on the right course. So we went on ahead and decided to use our application to NLAPH as the convening, as our sandbox, as our reason to stay the course. So next slide. So Jeff, thank you for bringing this slide up, because we knew what our data was from 2018, the workforce of community health workers, and we knew we wanted to get to growth. We wanted to aspire others, other providers and employers, to take on community health workers and continue the career path. And so you'll see on the right-hand slide, this is what we projected would be our growth spurt. And this data continued to inspire us. Next slide. So the big picture, and LAPH taught us to think big, but make sure it's written. So we spent time as a team creating a big picture of our objectives. What did we want to do as the Kansas Community Health Worker Partnership? Number one, we wanted to train new and existing CHWs for creating a robust workforce. We wanted to educate employers about what a CHW does do and how it can benefit them. And number three, we wanted to inspire payers to actually seriously consider paying CHWs what they're worth and then put it into a policy. So how did we intend to do that? Well, equip CHWs and allies, which I am one, with education, prepare self-advocacy tools, and do a campaign around the economic benefit, making the business case for CHWs, and then grow our membership. So how did we do? Well, we started with a network map, and I don't know if Ed remembers, we had difficulty doing this because we basically knew almost everybody in the state who'd want to be part of our group, but we didn't know if they had the capacity, because during the pandemic, out of 100 public health directors, 65 of them left. We also didn't know who was going to take up the charge. We didn't understand where the community health workers really were practicing, given what the pandemic and the lockdown required. So our network map in 2021 looked a little frail, but let's move to the next slide. So partnerships are thriving. We went on ahead, we reached out to whom we knew was still part of the public health infrastructure and system, and it's grown. This is just a sample of the partnerships and collaborations that our community health work partnership inspired many years ago. We have providers, we have funders, we have colleges, we have even people from Missouri. For those who are online today, we have people from Nebraska. We also now have South Carolina, and we have Illinois. Just recently, many of our extension systems in the United States have started thinking about how can they now help the community health workforce. So our network map back in 2021 looked a little weak, but if we go back now, it would be vibrant and strong. Next slide. So what did we accomplish? Well, soon after our academy experience ended, you'll see these fruits of our work. Yes, our coalition, which we are all now still part of, have a certified CHW pathway. We do education towards certification, and we also have experience that leads to being a certified CHW. We have a registry now of CHWs. This is all endorsed by our Department of Health. We have a CEU requirement that after certification, our CHWs put in 20 hours of CEU credit to continue on the registry. We have reciprocity with Missouri. I may say for our Nebraska friends, I think we're working with you on that too. We're exploring those certifications from neighboring states, which is Nebraska, one of those. And we have a board of directors, which I'm president of. I'm privileged to do that, which is comprised of 51% of CHWs. And we have 2 state proposals or plan amendments to increase the Medicaid reimbursement. Next. And where are we headed? Well, we have college credit for the class underway. We actually have that through K-State University. We are also starting a dual credit high school course through rural high schools, and we're now working on employer advocacy. Next slide. What did we learn? Leadership. It's about relationships. I said I started our story as friends, and we continue to be friends. I was oriented to the product. It took a while for me to figure out the product is really not as important as the process through the academy. We nurtured the team, we engaged others. We did adaptive leadership. As you might guess, we were one of the first cohorts to actually do the conference and all of our education online. I never got a chance to meet the actual Leadership Academy team. I'm so appreciative that Ed drove down to Kansas. I got a chance to meet him face to face. And we've learned from others. Ed helped us new and work with West Virginia, met Ed and met everybody from the Academy. And the courage in which we all address 2021 and continue to work with is paying dividends. So my final slide is thank you. Thank you so much to the Academy, to this opportunity. And for those that want to know more about the coalition, there's our QR code, and I'll be available for Q&A. Thank you.
Elaine, thank you very much. Impressive work. And one of the things that struck me is the fact that you actually started this whole process in 2017 and maybe even before in your mind. Tell us a little bit about your thinking in terms of the fact that this is a long-term effort. It's not just a one-year kind of thing, and you're still looking forward. So kind of take us through the work that you did with your team and saying, you know, we can't just do one little thing for today and tomorrow. We have to think about this long-term.
Yeah. Ed, thank you. In 2017, I approached awareness of what a community health worker was through an academic lens. I was aware of an academic course at a community college, and I was aware that there was somebody being trained to do community health work that was important, but it was an academic lens. So when I started to discover, well, Wichita State University is involved, but they're providing a backbone to healthcare providers, so healthcare providers understood what a CHW was. That then led me to know, well, the farm worker program through the Department of Health and Environment also had volunteers called promotores that were doing community health work from a more community level. And then my dear friend, Sandy, another extension person, but who had done extension in Africa, then started telling me, well, community health workers across the world, the globe. So every little piece of information became a wildfire. Not a bad one, but a wonderful one that inspired us to work together. Matt is wonderful. He's the business side of healthcare. I had no idea. And each little step, Ed, we built an understanding and appreciation for each other's strengths and awareness. The pandemic actually became an asset to us. We became more committed to staying in touch. We had monthly meetings, not only with the Academy, but with ourselves. And when we saw each other online in these little Zoom boxes, we became very comfortable with laughter, with some tears, with some struggles, and we continue that. You're absolutely right. It's not built in a day. It's built over a lifetime of being friends.
I'm impressed with the partnerships that you have, the many of them, and some of them I'm sure are resistant, like sometimes the insurance programs and sometimes hospitals and physician groups and business community. What were the arguments that you used, or the arguments, the points that you made, the data pieces, the stories, the things that you brought forward to get people to buy into the fact that community health workers are a community asset?
Well, a lot of people back in 2021 were not too enamored with what the data charts showed. That slippery slope of a chart that showed Kansas health rankings going down, that enticed some to listen, but it was really the personal stories, the personal idea of a community health worker, a volunteer, promotores, going to an aunt and uncle's house, not sure what they would find, wearing masks, trying to encourage people to get vaccination. Those personal stories really did bring more people into our discussion, because so many of us during the pandemic wanted to reach out and have personal connection. So I probably did not describe the big data that we did collect. Wichita State University continues to collect some of the data about the outcomes of community health workers in our state and where they are. But it was really that personal connection. Now, Ed, I do have to say the challenge now, we are registered, we are 501c3, we are certified, we are educating community health workers. We're up to 553 now through our courses. The challenge is now sustainment. And Ed, that's of concern. How do we sustain that workforce? How do we continue going? And we do have healthcare providers that are with us now because they see the positive results of community health workers who are keeping people out of emergency rooms, continuing to have them utilize their correct prescriptions, check their blood pressures, do diabetes A1Cs. So we are having some really good cooperation with our public health and our healthcare providers, but still, how do you sustain a workforce that really needs to be here, but how do you pay them?
Great, thanks, Elaine. And there are questions coming on the Q&A, and I hope we'll get to some of those when we get to the open dialogue later on. But thank you for that.
Thank you.
There are lots of questions I still have, and I'm sure the audience does too. So let's now go to our team from Iowa, Dr. Angie Tagtow, who is the lead of that team. And this is one that really focused on more on the nutrition and more on an issue oriented as opposed to workforce issue, but they overlap. And Dr. Tagtow is the founder and chief strategist for EGTA Strategies and has experience working at the local, state, and federal and international levels in the areas of food and nutrition policy, public health, and food and water systems. She is the former executive director for the U.S. Department of Agriculture Center for Nutrition Policy and Promotion, and in that capacity oversaw the development of the 2015 to 2020 dietary guidelines for Americans. She's a senior fellow and an endowed chair at the Minnesota Institute for Sustainable Agriculture at the University of Minnesota College of Food and Agriculture and Natural Resources Science, and a food and science policy fellow with the Institute for Agriculture Policy and Agriculture and Trade Policy. And she launched the Journal of Hunger and Environmental Nutrition, where she served as managing editor for 11 years. She recently completed her PhD or doctorate, her Doctor of Public Health, which says continuous learning is one of the things that you do, continuous quality improvement. Although she's a lot of quality right from the start, but she's doing a lot of work around structural empowerment and systems thinking, and led the team in Iowa, which I was pleased, even after the pandemic, was able to get down and talk with them. And so Angie, I turn it over to you.
Great. Thank you, Dr. Ellinger. Good afternoon, everyone. Elaine, thank you so much for sharing the Kansas story. That's very inspiring. I'd like to spend a moment to introduce our Going Bold Iowa team. And this is a picture from the NLAP orientation down in Atlanta in February of 2020. On the left, we have Lindy Buckingham-Schutt, Dr. Lindy Buckingham-Schutt. At the time, she was working at the Harkin Institute. Second to the left, we have Jill Lang, and she was with the Iowa Department of Public Health. We have our fearless coach, Dr. Ellinger, who was amazing asset to our work in 2020. Second from the right is Erin Berquist. She's at Iowa State University, and myself. Unlike Elaine, one of the challenges with our group is that the four of us had never worked together before. I had the privilege of being able to work with each of these wonderful individuals one-on-one, but we had not worked together as a team. But one of the common denominators of our team were the fact that we were all dietitians. We had a connection and a passion for public health and population health. And we, as you see, we each represented different sectors. And like I said, this was a new experience for all of us and didn't take too much to twist their arms to be part of the original NLAP application process. But I think we're so thankful that we did take that investment in time to do that. Next slide, please. So our overall project impact aims for our time in 2020 was to really looking at strengthen strategic partnerships and capacity of public health nutritionists, public health programs, and the agencies in Iowa to employ robust individual and policy system and environmental approaches for optimal impact. When we talked about data, we really looked at two different camps of data. We looked at workforce development data, specifically around training and education of dietitians and nutritionists who work in public health in Iowa. But we also knew very well the big data around population health factors and specifically diet-related chronic diseases within the state of Iowa, both in adults and children. And so we really took a two-prong approach to our project. The first was really building capacity within the Iowa Department of Public Health, both workforce, looking at policy and procedure opportunities, and also being able to integrate that health equity and that social determinants of health lens into public health nutrition work. And so not only were we looking at building workforce capacity, but really looking at how do we amplify individual interventions along with policy system and environmental tools with that health equity lens. The second aim that we outlined was looking at strategic partnerships. So really taking that external approach to stakeholder management, building and dietetics education. Next slide, please. So Elaine has already outlined many of the challenges that her team faced in 2021. But again, to put our experience into context, we attended the NLAP orientation in Atlanta in February 2020. Needless to say, we had absolutely no idea what was about to unfold in March of 2020. And even though we each represented different sectors, we each experienced to varying degrees workload, workforce, and worksite changes in 2020 as a result of the pandemic. And so following the NLAP orientation in Atlanta, we were prepared to pursue what we thought was a pretty aggressive work plan, 12-month work plan. But come April 2020, we realized that we needed to make adjustments in the work plan, and we ended up continuing to make adjustments to that work plan throughout the year. We also recognized come March and April that the external partners that we were planning to engage and work with were also really struggling to navigate how the pandemic was affecting their work. And so we kind of backed off on the focus working with partners externally. So we focused more on our individual organizations and specifically within the spaces that we had more control. In addition to the work challenges related to the pandemic, unfortunately, our team also experienced some pretty significant personal losses during this time. But this further enforced the need for our team and our partners to be flexible and to also focus on those highest priorities. Next slide, please. The bottom line is we did what we could, and we focused on the things that we could make happen. And a key decision for us in the spring of 2020 was to focus on our relationships as organizations and also looking at the assets that were still there among our respective organizations. And we now realize that in retrospect, 4 years later, those relationships have continued to grow. They've been nourished over the last 4 years, and we've seen some pretty remarkable things happen over the course of the last 4 years. This included the networks in which our team served as particularly gatekeepers, including Jill's Bureau of Nutrition and Physical Activity at the time, partnering with her supervisor to strengthen relationships across the Iowa Department of Public Health bureaus and divisions specifically focused on PSEs and health equity. And Dr. Ellinger was instrumental in helping us do that with his site visits that year. During our experience in 2020, we did use the NLAPH learning model to really focus our work plan. And I think it really helped us to prioritize our activities and our strategies. Some of the things we did to make ongoing progress were foremost, exercise agility and lots of grace during that time, as many of you probably did as well. You know, we did the Myers-Briggs inventory in February as a team, and I think that really shed light on our assets, our similarities, and our differences. And a few of us were a little amazed and maybe a little annoyed at what the results were, but nonetheless, that exercise really allowed us to make decisions in our work plan that best suited our strengths and our abilities. And so that was really instrumental at the get-go to navigate these new challenges that we were experiencing. We focused on making progress versus seeking perfection. So as many of you know, when you get together a group of people who tend to be more on the type A side of things, you set bars pretty high. And we did that with our original plan. We set a pretty high bar for our plan, but we realized that these were challenges that we were experiencing that were much beyond our control. But if we continued to make progress, during the course of 2020, we knew that we would be in a better spot at the end of our time together. In addition to the disruption because of the pandemic, we exercised some very strategic thinking, and we even did some scenario planning as we witnessed the Iowa Department of Public Health leadership, their capacity, and their authority being diminished. In the summer and fall of 2020, the Iowa governor launched an initiative to merge the Iowa Department of Public Health with the Iowa Department of Human Services. And this was ultimately implemented in 2022 and 2023. But the first inkling that that was going to be a possibility really happened in 2020. And so being that the Iowa Department of Public Health was really our point of focus for our work, this became an added element into our discussions, and the ability to do scenario planning and strategic thinking just to navigate the unknown during that time was very helpful. Next, communication. Elaine had mentioned this. Communication was very key with our team as well. At the get-go, we established a regular meeting schedule. We created an online folder for our materials. We kept a team journal for all of our notes, and we had a master work plan which housed all of these wonderful MLAP tools that we were using. And so it was really one-stop shopping when it came to document management. And then the last element that I wanted to highlight that really assisted us in navigating the complexities during this year was the application of systematic reflection. I believe that it really introduced a different way of sharing and identifying perceptions and other pieces of information about what we were experiencing. And I believe it really strengthened the trust and our relationships between the four of us. And so the next slide, please. Not intended to read, but this was a snapshot of a visual representation that we created for our year-end report. And, you know, as dietitians, we used a recipe format. So that was our art applied to our science here. But the question that when we got to the fall of 2020, did we make a difference? Did we move the needle in any way, shape, or form? And we did. We did build internal capacity at the Iowa Department of Public Health. on individual and policy system and environmental change activities, as well as integrating health equity and social determinants of health into public health nutrition initiatives. Relationships both internally and externally, surprisingly, blossomed and started to bloom. Some of them may have been lifelines, people really being eager to retain existing relationships amidst the pandemic. But we also saw some policy system and environmental champions emerge, both internally within the Iowa Department of Public Health and even by some of IDPH's partners as well. Some of the things that continue to progress and evolve even today is the integration of PSEs into existing public health nutrition initiatives, including WIC, and in things such as policies and procedures, competencies and standards. And so we really were looking at what types of levers, specifically in the policy system activities, could we do to embed these constructs into the work that we do. And certainly, there was a degree of disappointment, sure, in not reaching our original work plan goals, especially with the external relationships. However, I think we knew that what we did accomplish during that short period of time was planting the seeds. It was just the start of greater things to come. Next slide, please. And so to that note, we've held to that commitment. Our work and our relationships continue to flourish. From the perspective of the Iowa Department of Public Health, Jill, she is a trooper. She weathered the merger of the Department of Human Services and the Department of Public Health. She has, for example, secured funding to launch a Healthy Eating, Active Living partnership with a specific focus on PSEs and health equity. She has been able to forge new relationships with new emerging groups, including the Iowa Food Systems Coalition, and has made a commitment to outline the role of the Iowa Department of Health and Human Services in the new Iowa Food Plan, which was just released earlier this year. Jill continues to be one of the strongest advocates for advancing PSEs within the Iowa Department of Health and Human Services. And if I may say, she really was the inspiration behind my doctoral research a couple of years ago, and even convinced Jill to serve on my dissertation committee. Thanks to her for that. Moving on to Erin. Erin has been involved in transitioning Iowa State University dietetic education program from an undergraduate degree program to a master's prepared program. And in doing so, she has been able to integrate policy system and environmental change agents, as well as systems thinking, into that curriculum and experiential learning. She has even been able to communicate what she's done at Iowa State around the integration of these constructs at an international level. And I think this experience, the LAPH experience in 2020, influenced Erin's current doctoral work, in which she's examining systems thinking application by dietetic educators. And ironically enough, Lindy is currently serving on Erin's dissertation committee. Moving on to Lindy. Lindy has a new position with ISU's Cooperative Extension and Outreach, with the goal of integrating individual and policy system and environmental change across ISU's Extension's food and nutrition initiatives. Last fall, Lindy and her team received CDC funding to address high obesity regions in Iowa, and her strategies are focused on leveraging PSE change in local communities now across Iowa. Myself, one of the impetuses behind our work in 2020 with a focus of I plus PSE produced a publication in 2020. I published an article on a conceptual framework to advance PSE, specifically in nutrition and dietetics. And our team was very instrumental in informing that final framework. I completed a doctorate in public health last year, as Dr. Ellinger mentioned, and interestingly enough, with an emphasis on adaptive leadership, systems thinking, structural empowerment, and systems transformation. And I think it's just been wonderful to be able to incorporate these constructs and these strategies into my consulting business. One way I'm doing that today is serving as a technical advisor with CDC in helping grantees in implementing PSE approaches. Lastly, I just wanted to mention that unlike Elaine's team, our team did not have a formal relationship prior to this work. But even today, we continue to meet. We continue to share ideas. We ask for support. And whenever we do meet, we always eat good food. That's a requirement. And I just anticipate that the seeds planted in 2020 will continue to produce amazing things down the road. So last slide, Jeff, please. When I was asked to share some remarks today and in preparing these slides, it really offered another opportunity to reflect on our team during 2020 and what has evolved in the last few years. And really two themes have come to mind, and you'll see the two quotes from Maya Angelou. And those themes, I think that I hope my teammates would agree, kind of encapsulated our experience in 2020, were courage, just like Elaine, and persistence. So thanks for the opportunity to share the Iowa story, and looking forward to the discussion. Thank you.
Angie, thank you for that. Powerful story and huge changes in Iowa and impact on individual advancement and system advancement. I was particularly struck at the change that you had to go from developing external partnerships to actually focusing on the internal relationships. That, and along with the dealing with personal tragedies, with its struggles, knowing, I mean, I've led organizations and I know just under the surface, there's every system that has people involved people are dealing with struggles at home and at work and at other places. Tell us about how that focus on internal relationships, and then how that helped with, actually helping people through some tragic times in their own lives.
Yeah, so I think thinking back to the spring when the pandemic hit and we realized that our original work plan was quite substantive. It was involving as many folks as possible to move the needle. And when you work, as many of you have experienced working in public health, and when these type of events and especially the pandemic hit, being agile and being flexible are really, really key, but also keeping an eye on the original aims and goals. And so because we had such a robust work plan, it was unanimous on what areas to dial back. And key for us was, what do we really have control over? What really can we tackle within a finite period, what we've committed to do? And so everyone had a degree of leadership within their organizations. They could make and manage certain decisions. And so we really focused on, this is a pretty challenging time in global public health. And what we need to do is really focus on making sure that the existing relationships between the Iowa Department of Public Health, the Harkin Institute, Iowa State University remain strong. And so we really focused on that. And I do believe that because of that decision to really narrow our focus on the partnership piece enabled us to then advance external partners after the fact. Once things settled down in 2022, 23, we were able to really focus more on those external relationships and get back in the game, if you will. But as far as the personal tragedies that we experienced during that time, definitely unforeseen, of course, but it added an element of a higher level of relationship, I think, between the four of us. And for that, I'm deeply grateful. That has now evolved into very deep, long-standing friendships.
Great. And so tell us where you think that the relationships you have now are going to kind of lead with external partners. What do you think some of the next steps are?
Yeah, well, we're already seeing the fruits of that work, I think, Ed. Jill continues to be that champion within the Iowa Department of Health and Human Services in advancing policy system and environmental change strategies, not only in healthy eating, but also in active living circles. And she's also made stronger connections within the department to advance that work. So there are other areas within chronic disease prevention and even in substance abuse that she has forged those relationships and advanced those relationships. And I think with, for those who might be listening in today, those who have worked at the state level and have seen either a merger of human services with public health or even a divorce of those two agencies, a lot of change happens. But what Jill has been able to do is she's been able to elevate the PSE discussion into the new administration for this new mega agency. And PSEs have been embraced by the administration, the Iowa Department of Health and Human Services administration, which is great. With Lindy transferring from the Harkin Institute to Iowa State University Extension, I believe her job description even highlighted having knowledge of policy system and environmental change approaches in food and nutrition. And so she totally leveraged that. And she is able to, again, look at policy, procedure, and program chains that truly integrate PSE and health equity into ISU Extension's work. And even with Erin, I think the relationships that she has now built internationally around dietetic education, systems thinking, and sustainable food systems has really, I think, elevated her network well beyond the boundaries of Iowa to an international level. And so my role in all of that is to help them all achieve those types of goals within their setting.
Great. Well, thank you. Lots more questions, but we need to go on to our third presenter. So we've got Margarita is the State Health Plan Coordinator at the Wisconsin Department of Health Services, the Office of Policy and Practice Alignment. She facilitates the implementation of the State Health Improvement Plan and supports partner engagement in the state health assessment. She has a background in social, economic, and public health policy, as well as community engagement and data-driven decision-making. She also served as the University of Wisconsin Population Health Fellow prior to moving to the Department of Health Services. And her areas of focus are social determinants of health, health equity, systems and environmental change, and bridging social, economic, and public health policy with community experience. As I said, Margarita was not part of the initial team, but has taken the reins from the people on that team, particularly Paula Tran, who is now the State Health Commissioner or State Health Director, who was the team lead on the LAPH project. And so it's nice to see how this carries on. Like Elaine had talked about, it's a long-term kind of event, and this program is going on since 2013 and has really, I think, impacted what's going on in Wisconsin. So Margarita, let's hear your story.
Good afternoon, everyone, and thank you so much to the Academy for allowing us to tell our story in Wisconsin and providing this opportunity for us. As Ed mentioned, I was not part of Thrive Wisconsin and the Wisconsin Alliance of Health Equity, which was kind of the Wisconsin team in this NLAPH effort about a decade ago. But Paula Tran has been my mentor and advisor for the state health plan work for close to a decade now. So a lot of the work, and our current state health officer. So the work continues to carry forward. And our story really is a great example of how you can plant a seed and you don't know what you're going to harvest a decade later and where the work will go, but this work continues. And I'm here today to tell the story and show how it shows up in our work at the Division of Public Health at the Wisconsin DHS. Next slide, please. And we can skip to the next slide. A few words about the Wisconsin State Health Improvement Plan. It is a statutory mandate for us. So state statute mandates us to do a state health plan at least once every 10 years. We're currently on a 5-year cycle because of best practice and requirements for our department. But what the state health plan is and is statutorily mandated to do is to provide a public health agenda and a public health roadmap to community health improvement and population health improvement across the state, a roadmap for policy system and environmental change that can lead to this change, and really a guiding and foundational document for our department and state government in our state on how resources should be allocated to achieve more equitable and overall better health outcomes across the state. It is very closely related to local health departments and local public health agendas, as well as our federal public health agenda, Healthy People 2030. Within the state health plan, we have 3 distinct processes. The state health assessment, which is a very large overarching assessment and process that allows us to map out what are the major health conditions, what are the resources and assets, and what are the local social and economic conditions and contexts that do impact health outcomes and diseases across our state. After that assessment is done, we take a lot of what we have seen in the assessment and move into the development stage. The state health assessment results really do guide how we develop and prioritize resource allocation in our state and how we develop the state health improvement plan. And then after that, we go into the SHIP implementation stage where we currently are this year. Next slide, please. I wanted to share with you the guiding principles for our work because they really show the connection with what Thrive Wisconsin and the Wisconsin Alliance for Health Equity started about a decade ago. A lot of the work that was done through the Academy at that time and the strategy that came out of that work carries forward in our guiding principles and our strategy for the SHIP. We have set to center equity, lead with community stories, and honor the contributions of community voices in our process and in our outcomes and work. We have decided as a team to move upstream to prioritize policy system and environmental change in our state and to promote health and health policy approaches to address social determinants of health that impact health outcomes. We have set to deeply engage with our partners and really focus and invest in building alliances, in building community capacity, in engaging in community power building, and to focus on structural and systemic causes away from individual responsibility and additional burden to families and individuals who are already experiencing the burden of health inequities in our state. We have also deeply engaged in reflection and understanding of how power dynamics play out in our state and in rooms with our partners, and making sure that we're accounting for those in all of our processes. And we're also highlighting the SHIP work as a long-term public health agenda for post-pandemic recovery and system resilience, as all of us were thrown right in the midst of the COVID response in Wisconsin. As you can imagine, we really are carrying those lessons learned into this long-term public health agenda for our state. Next slide, please. And you will see later on when I show you what our agenda looks like, you will see why we really, really needed to focus on partner engagement and alliance building. Our agenda is very bold, and it's very much rooted in what Wisconsin community members and community leaders told us about the conditions on the ground and what we needed to do alongside our institutional partners and community partners to change the situation. So within our both state health assessment and state health improvement planning process, we engaged with over 200 partners, and I think that's on the low end. We actually may be closer to 300 partners with the development of that agenda. During the state health assessment process, we leaned very heavily on qualitative data, with a lot of the community conversations and listening sessions being conducted by local health departments and the local community-based organizations. And we really put our whole state health assessment in the hands of our community members. In 2022, when we developed the state health improvement plan, that was, as you can imagine, more on the tail end of the pandemic, where we didn't know how things have changed on the ground. We didn't have time to engage in a fully fledged new assessment. So what we wanted to do, again, aiming to put all of our kind of priorities in the hands of the community and community leadership, we called 6 sessions and community conversations with CBOs, community-based organizations in our state. And quite a few of them showed up to our call. And it was really a very robust discussion of how have the community conditions changed with the pandemic, and should we continue with what we have previously set to do, or how should our agenda change? Then we took all of this information from our community-based partners. We created a framework, and then we decided that it was time to engage our institutional partners, who will have to largely carry forward the policy system and environmental change work that we needed to see happen across our state. So we engaged with local and tribal health departments, other state agencies, councils, advisory bodies, membership organizations, associations, advocacy groups, healthcare, academic partners, and funders to carry this agenda forward. After we had all of this engagement, we went back to our community partners. We showed them what we currently had, and that was our accountability stage. And we said, have things changed from what you told us about 6 months ago? And is this still what you would like us to see being our direction? And they concurred with us. We actually had an agenda that was largely supported by our grassroots partners. Next slide, please. I wanted to also highlight what is the current implementation strategy for our state health improvement plan. Again, because you will recognize here some of the foundational strategy that came out from the work that was done 10 years ago, and our team continues to carry forward. We are really focusing on shifting public narratives and shifting the understanding of what truly creates health, what are the conditions for health, and the policies that will bring better health outcomes. And not only in the area of public health and in the area of healthcare, but really what are the upstream policies, the power dynamics, the community power that is necessary to achieve better health outcomes, and to really educate our decision makers across the state that investment upstream, investment in social determinants of health, is prevention, and it will lead to better health outcomes, lower hospital and healthcare bills, and as you can imagine, all of the other outcomes downstream. So really shifting those narratives. We've engaged in multiple narrative trainings for our own staff and for our partners, and we'll continue to engage in shifting this public narrative, because we know that if the narrative and the frame of mind doesn't change towards more system change and upstream work, then we will never be able to achieve the health outcomes results that we want to see in our state. So it's kind of a precondition for us to be able to move this work downstream. And then we also have focused on promoting equitable policies and decision-making alongside our partners at the Office of Health Equity here at DHS, working with other state agencies on making some of these connections and how their decision-making and the impact of their decisions then impact communities and health outcomes downstream. And then finally, we're engaging very deeply with aligning people and resources, aligning our funding with some of this work, with our team leading a couple of funding opportunities, one of them mobilizing communities for just response, and a qualitative data and elevating community voices efforts for capacity building for our local health departments. But with mobilizing communities for just response, what we're really trying to achieve is provide flexible funding opportunity for our local partners to be able to build partnerships, mobilize community power and community partnerships, regardless of what the topic of their work is, and being able to really put this the resources as close to the ground as possible. Next slide, please. I believe this is my final slide here, and just wanted to share with you, this is our SHIP framework with the priority areas for the state of Wisconsin and public health in terms of population health improvement, and you can see how much is in it and how overwhelming it can be. This is why we needed to take this approach to our work. Our vision is our health equity statement of all people and communities in Wisconsin having the opportunities and supports that they need to reach their full potential. And we have separated our agenda into our foundational shifts, which are really those deep changes to our system that need to happen, if we're lucky, maybe in our lifetime, addressing all of the institutional and systemic inequities that exist, all of the isms that are inherent to a lot of our systems, ensuring that there's representation and access to decision-making and community voices in all of our program design and how we do the work, and ensuring that resources and services are centered as close to the ground and as close to our communities as possible for maximum impact on the local context. And within our priority areas, we're elevating, of course, the social determinants of health. And because it's not always politically possible in our state to say health equity and social determinants of health, we have named this particular priority area as social and community conditions, focusing on economic well-being, supportive systems of care and childcare, and healthy and accessible and affordable housing. We're also lifting up physical, mental, and systemic safety for the first time, really calling out the importance of systemic oppression on health outcomes in our state, focusing on person and community-centered healthcare, social connectedness and belonging. Within this priority area, we're also lifting up the importance of civic engagement and civic participation for better health outcomes. And finally, mental and emotional health and well-being, which also has nestled some behavioral health and suicide prevention approaches in it. And I believe this is all that I have. Next slide will show a link to our state health improvement plan in case you're interested in exploring further. And please stay in touch. Would very much love to continue this conversation.
Margarita, thank you. Again, impressive on how this project back in 2013 has really influenced major changes in Wisconsin and the way the health department is focusing on your work. And it also addressed one of the questions that came in during the Q&A is, how are you addressing social determinants of health? Obviously, your whole system is built around that. The one question I have before we open it up to general questions for everybody is you mentioned the narrative, you're working on narrative change. And you also have, I know from looking at some of your other slides earlier, the number of partners that you have, the faith-based communities, hospitals, business communities. How do you link that narrative to get people to understand that they have a role to play in creating health, whether they're churches or mosques or synagogues or businesses or park systems? How did that narrative change work?
Yeah, and I would say with some sectors, we're a little bit further ahead, and it's a little bit easier than with other sectors. So we do try to meet people where they are in this process, right? For some, it's clear enough for us to say, we're here to work with you on social determinants of health because they are important for these reasons. And people tend to come along, and with other partners, it takes a little bit more work. So we are working to build the narrative capacity across our own public health system so that those conversations can happen at multiple levels, right? They can happen at local level where the local health departments can be talking with the local business association where we can't really go. And then we can have that conversation on state level with some of our state agency partners who are working on housing or economic development. So really this narrative work is happening on multiple levels, and some of it shows up in our documents, in our policy analysis, in our press releases, and some of it shows up in terms of capacity building on local level and quite frankly, sometimes on national level and state level. Yeah.
Excellent. Now, for folks in the audience, if you have questions, put them into the Q&A, and we're going to bring everybody up on screen and have some general conversation. One of the questions that came in asked really about what barriers did you kind of accomplish? Because some people don't like change, and people like to keep things the way it is. Talk a little bit about any barriers that you may have encountered and how you address those.
Well, Ed, I'll start that conversation off. One of the challenges that we had from a workforce standpoint is convincing public health dietitians and nutritionists that, yes, policy, system, and environmental change strategies are part of our work. Knowing that, many health professionals are trained extensively on individual behavioral change approaches, but not so much on how do we leverage policies to make population health change, or how do we change transform systems, or how do we create, whether it's built or natural environment change to support healthy eating and active living. And so there were some challenges there in convincing our little group of folks that we were working with that, yes, this is part of our work, but more importantly, these are the gains that the health of Iowans will get if we incorporate our individual behavioral approaches as well as policy, system, and environmental change, specifically around healthy eating and active living. And so it did take a little bit of time, but I do believe our WIC staff here in Iowa now are very aware of this new lexicon that's been introduced to them, and it's actually been integrated into Iowa WIC policy and procedure today.
And I'm curious, Wisconsin and Kansas are not noted to be at this point in time the most progressive states. And so I'm sure you encountered some changes. Elaine, what kind of challenges did you have?
I think I'm a challenge. And the reason why I say that is when we joined the NLAPH opportunity, I was one of those, Angie, I think you said A personalities, get it done. We have an agenda. We have a work assignment. We're going to be productive. And then reality hit. And it took a while for me. And actually, I think it was around the time we did our little personality assessment that I realized this was a leadership opportunity for me. And I think then we all began to breathe easier that our production was not as important as being together. And so the challenge has been, we're optimists. This group of 6 of us still are in touch. We are optimistic. And when we confront systems, they aren't necessarily too enthusiastic with us. So the reentry from the Leadership Academy back to the real world can be a challenge. But we still communicate, we still support ourselves as a team. But that's a challenge when you re-enter back to the real world after a year long of just wonderful learning.
The reality of life. Margarita, any challenges that you're experiencing?
Oh, quite a few on all kinds of levels. So it takes every cell of my body every day not to get too frustrated and to remember that challenges are important. And it is important for our work to be challenged so that we can move in a more thoughtful and intentional way. I'm one of the people who isn't necessarily always comfortable with change. So I keep asking myself, what is it that I need to hear and know so that I can engage in a change discussion? But in terms of challenges, there are quite a few. Some of it is just the inertia and like, this is how we've always done things. Why are we trying to change it now? And some of it is just really practically speaking to people, knowing your audience, right? So depending on who you are in the room, your approaches may change. But practically speaking, just trying to, instead of put a value statement or a judgment statement on this is the wrong approach or this is the wrong thing to do, I also try to explain, if we keep doing this, this is the result that we should expect seeing. If we change it this way, we're likely to see a different kind of outcome. So walking people backwards from the kind of outcome that we would like to see. And then, of course, the political pushback sometimes around language. And I think both of our speakers have spoken a little bit about it in terms of, public health being on the receiving end of a lot of pushback during the pandemic, and that carrying forward with a lot of our racial equity work. And now it's turning into a little bit pushback around like social determinants of health. And why are you here talking about housing? We don't understand. And, all of that's happening. You can't say health equity. And so it's been a bit of a word game, but really trying to get down very deeply to what do we mean when we say health equity? What is our role? Why should we be at those tables? Why should we be consulting and providing an analysis of, all right, if you make this decision on housing, here's what this is going to look like 5-10 years down the road in terms of hospitalizations, right? So just being there to very practically show these things and take out the emotions and the value and judgment statements, and like the words are important, and we continue to say we're here to do equity work, and those are the outcomes that we want to see, but not getting too deep into the words, and really trying to be honest and direct about what we're trying to achieve and how.
Well, this time has gone very, very rapidly. So I want to leave you with one question each. What, the three of you, what ahas did you take from this session? What did you learn from your colleagues on this panel? And what steps are you going to take in your leadership journey from this point on? So let's start with Elaine. What ahas did you get today, and what are you going to take forward from this?
I was going to say, Marguerite, yes. The words we use matter. They matter. And then the word of a leader. If any of us on the Zoom today are called a leader, then the words we use should be in a right framing. And again, I learned that concept by being with the Academy. So the framing is important, and I'll take away some of the framing that I've heard both Margarita and Angie use today. So thank you.
Good. Angie, how about you?
Loved hearing Elaine and Margarita's story, and being a Wisconsinite also definitely tuning into what Margarita said. But I think the aha, not only at that time in 2020 when our team was working on these initiatives, but throughout my career, and even listening to both of them today, is that political awareness. We have a lot of folks in my profession that don't believe that policy plays a role in our work. And policy and politics need to be part of our conversations so that we can best navigate the policy and the politics that may actually influence our work. And so that continues to be an aha, and listening to public health professionals in other states and their experiences and how to navigate, especially state legislation that's being imposed on them. I just am a big advocate for making sure that policy discussions are part of our work.
Great. And Margarita.
Yeah, ditto to everything that Angie and Elaine shared, but I also wanted to lift up just how human the space was. So hearing your stories and the fact that so many of us were going through similar experiences and emotions, regardless of where we were or who we worked for at that time or our roles. Just some of that, your human stories and experiences really touched me, and I'll carry that forward.
Yeah. Well, I like the fact that you are making huge impacts in your states, and certainly among the team members. And it's a longitudinal thing. It's not just a one-time thing. It goes on, and you're having impact beyond just the scope of your state. And that means that we're all connected. We're all linked in this. And I really like the fact that what I heard from Margarita in particular, when I was health commissioner, I put together something called the triple aim of health equity. Expand our understanding, change the narrative about what creates health, implement a health in all policies approach with health equity as a goal, and build community capacity to have communities to create their own healthy future, all around the issue of equity and social justice. And that's what I heard in the state plan in Wisconsin. And it means that we're all learning from each other, and we're advancing health equity by changing narrative, doing a health in all policies with a policy system environmental change strategy and workforce development, and we're building community capacity. And it's all about relationships. I don't talk about person-centered care. I talk about community-centered care. Everything is in relationships. And so you guys highlighted that fact that relationships and partnerships are so important. And so thank you for taking the time to be with us today on this first of the Masterclass series. I think it was a good start to what I hope will be an ongoing series. And I appreciate everybody who came onto this, and the next session that's going to be coming up on July 16th, which I think is really going to be fun to talk about tapping the power of all arts and culture and improving health. So I think they're going to be putting some links in there. So I thank you all for being with us today, and do whatever you can to form a partnership in your community and beyond, and engage communities as effectively as you can, and have some fun in doing it. So thank you all.